Bone marrow harvest has been performed manually by the operator using a bone marrow harvest needle. But Next 21 uses the principle of a tunneling machine shield machine. We have developed a device that cuts and collects bone marrow while using a rotor. Since the nickname of the shield machine is Mole Talpa, this ultra-compact device has been trademarked from Grillo Talpa to GryGry TM. The spiral screw pipe is driven by a motor to rotate left and right, and is a self-propelled type that can move forward and backward. So it is easy for the operator to operate. Bone marrow harvesting is possible. GryGry is easy to operate. The green button advances and the orange button reverses. By changing the angle little by little and repeating this, a large amount of bone marrow can be harvested with a simple operation. The rotating pipe has a spiral screw structure, so it can bend like a bellows hose and move forward and backward through the bone marrow cavity. By adjusting the angle of the tip of the pipe processed into a helical screw shape, it is possible to cut at a low speed without damaging blood vessels, etc. Safe bone marrow collection is possible. Synchronizing the tip angle and progression speed can minimize damage to target cells, mesenchymal cells in the bone marrow. Regen's marrow miner is a drilling mechanism for petroleum oil wells. Since bone marrow cells are collected, there will be damage to the target cells. GryGry converts rotational force into propulsive force, cutting the bone marrow with the rotation of the tip, and aspirating and collecting it from the pipe hollow. It took more than 3 years since Next 21 applied for a patent, and the patent was approved by the Japanese Patent Office and was established as a patent. We have also filed PCT applications in the US, Europe, China, and we believe that we will be able to develop our business in the international market with a competitive edge and less competition with rivals. Bone marrow harvesting has the following several problems. Since the amount of bone marrow obtained from one puncture is small, there are cases where more than 100 punctures are required. Patients suffer a lot of pain. This is the most well-known problem. The operator who performs the puncture also has to work for a long time and requires a lot of effort. Patient also require hospitalization and pain management. Higher medical costs. Harvested bone marrow cells are often damaged, which affects the clinical results of regenerative medicine. There are many manufacturers of bone marrow harvesting devices as the forerunners, but the products of manufacturers with blue letters are manually operated biopsy needles principle. KLS Martin can rotate the biopsy needle with an electric drill. The RegenMed system product is the most advanced, with a motor-driven rotating tip that aspirates crushed bone marrow. Manual biopsy needle structures dominate the market, with unit prices in the hundreds of dollars. Although the market is small, it is expected to grow both in procedures quantity and in the future. However, Regen's motor-driven marrow miner costs $5,000 and is disposable. For this reason, once the new generation of bone marrow harvesting devices such as GryGry become popular, the unit price will increase tenfold and the market will grow significantly.